Hi everyone. We will be discussing the scope of practice of a CNA, a Certified Nursing Assistant. So you're thinking of becoming a CNA. What a timely and formidable topic. Baby boomers and all Americans are living longer, and our healthcare system is overused and understaffed. There's a supply shortage that is seen across the board in all of the healthcare spaces. In all of the healthcare sectors or spaces, there are opportunities that are necessities, and those opportunities are abundant. The outlook for CNAs is very, very strong, and they work in all forms of healthcare. They work in hospitals, doctor's offices, hospice care, nursing homes, home care, assisted livings, and others. Let's talk about what the scope of practice means for a CNA. So scope of practice basically just means what you are and are not allowed to do. So what is a CNA allowed to do? That is your scope of practice, what the CNA is allowed to do. A CNA, the scope of practice for a CNA describes the who, what, where, when, why, and how of the CNA practice. And by the way, scope of practice has nothing to do with the stethoscope. Let's take a look at some of the qualities of a CNA. The qualities necessary for a successful career as a CNA include patience. Patience, as we've been told throughout the years, is a virtue, many times seen as the top skill of a CNA. Patients are vulnerable. Your patients, not patients, but patients that you take care of are in a vulnerable state. They're scared. And because of this, you may become the target of their aggression and their frustration. So again, your patience is a virtue. Compassion. Your patients are hurting, and your care and compassion can have a huge impact, not only on their behavior, but on their physicalness and their diagnoses as well. Sense of humor. We've been told that laughter is the best medicine. Laughing can help manage anxiety and tension and stress. It is said that laughter can strengthen your immune system. And again, you are dealing with people who are scared and they're anxious and they don't feel well. Strong work ethic. CNAs are really in high demand, and quite frankly, that demand is expected to keep growing. Your schedule can often be full, or actually over full. Staffing is often short, and that is something that you're going to have to deal with. CNAs, since they are in such high demand, are expected to put in long hours. So a strong work ethic is a huge quality when you're a CNA. Quick thinking. This trait helps save lives. Being aware of your surroundings and noticing when patients are in need can help to save a life. You may be going to take care of someone else and notice something going on in another resident's or patient's room. Just the fact that you are able to think quick on your feet may result in a life being saved or a crisis being averted. Let's move on to a day in the life of a CNA. CNAs often work, as we talked about, in various settings. They can be found in long-term care, in rehab, in hospitals, at home, and at different types of care centers. Nursing assistants are involved in direct patient care, assisting the doctors and the nurses and other healthcare providers with treatments, procedures, and tests. This is a beautiful little YouTube video of a day in the life of a CNA. It's very well done. I hope you enjoy it. While a CNA often works independently, and your work is often between yourself and your patient or your resident or your client, whatever setting you happen to be in, you are part of a greater team. That team consists not only of healthcare professionals, but it also involves your patient and your patient's family. So sometimes conflicts occur. When, not if, that happens, you must remain professional. Shouting, profanity, insults, and demeaning behavior are invasions of personal space, and it's not okay. Listening to your patients. They are part of your team and they have the right to direct their care. That's actually in the code of patient rights. They have the right to direct their care. You cannot force a patient to do anything. Just remember, listen. Care plan. A care plan will direct what skills will be performed. It keeps everybody on the team within their individual scope of practice. You must follow what's on a care plan. And if it's not on the care plan, then you must not engage in that skill. So here are a few categories that the CNA scope of practice includes: personal care, safety and emergency, basic nursing skills, infection control, communication, cognitively impaired and mental health, basic restorative care, and residential rights. We can break these down a little bit further by talking about different activities that are involved in each one of these categories. Basic daily nursing skills and patient care are any of the treatments that you see in front of you, obtaining vital signs, measuring height and weight, and various abnormalities in body functions. Personal care skills, bathing, grooming, dressing, etc. Basically taking care of the personal needs of that particular resident or patient. Care of the cognitively impaired residents and their mental health and social service needs. Infection control, healthcare associated with infections, chain of infections. You need to understand infection control and you need to follow it. Communication. Communication is one of those categories that seems to be very easy to understand and yet has so much involved. It's not only being able to verbally express what you're feeling and thinking, but it's listening, and it's active listening, and it's your nonverbal communication, the cues that you are sending to the others with whom you are communicating, the cues from your body language that you are sending. And then your various charisma. Are you charismatic when you communicate? Or do you stand there and look down and mumble? Basic restorative services, using assisted devices and transferring ambulation, eating, dressing, and proper turning and positioning in the bed and chair. These are all restorative services. And finally, providing privacy and maintenance of confidentiality and promoting the patient's rights. This is a breakdown of the scope of practice for a CNA. Thank you for your time. Are you still thinking of becoming a CNA?